Miss Mercedes Tristan from Conroe, Texas, in doing thermography services for us today. And she did full body thermography, and she did some comprehensive from head to waist, or half body and abdomen.
Yes.
And she's going to explain to us what that is that she did that gave her the results. And there's two specific things that she shared with me that I was really blown away about, because I never would have thought the technology of this camera would have picked up something so minute. And the company that she uses that does the readings is going to probably, more than likely, based on her experience, tell us exactly, and the client, what it is that's going on. So, Miss Mercedes, take it away.
Thank you, Dr. Georgia, for having me today.
You're
so blessed. Thank you. So, yes, I do different thermography images or scans. The most popular one is the full body, because we do scan thermography from top of the head to the bottoms of the feet. We get the feet, front, back of the body, the sides of the body, pretty much every part of the body when we do a full body. And it's very important because we're able to see pattern within the body. If there's inflammation, people that have cardio issue, vascular issue, if there is something going on with the chest or breast, we can detect the patterning early on versus having other invasive testing. And so this is a non-invasive, it's painless, it's contactless, it's very private. You know, I sit behind the panels and I take the images with this amazing camera. It's a flare camera, and I really like to highlight the camera because other thermography cameras are anywhere from 17 to 90,000 megapixels, but this particular camera is 161,000.
Wow, 161,000.
161,000 megapixels.
Let me go back here and think, okay?
That's okay.
Okay. The normal thermography cameras are
17 to 90,000.
17 to 90,000.
Whereas this flare camera, and it's a company that directly works with MedHot, that's the company I work with, and it's 161,000. So when I'm taking images, I'm able to see eyebrows, I'm able to see baby hairs, I'm able to see, you know, lashes. If there's any kind of oral cavity issues, the inflammation will show up. Any kind of patterning trickling down from oral cavity issues, like root canals, or...
Can it really show patterning?
Yeah,
or,
patterning. You can see the inflammation trickling down.
From the teeth?
From the teeth, yes.
From the teeth, whether it's a root canal, no matter what.
Implant, or if it's a tooth that has a cavity, or any gum disease. Yes, ma'am.
Seriously?
Yes, ma'am.
You're giving me
It's a very sophisticated camera, very sophisticated software. And MedHot carries their own special software. It's not, you're not able to purchase it. You have to be with that particular, or with that company.
Oh, wow.
And have that particular software in order to get all these fancy bells and whistles.
Right,
that
so
go,
it's designed specifically for this.
For this camera.
Yeah, for that
yes,
camera.
ma'am.
That's
Yes, ma'am.
amazing.
So one of the nice things I've been able to see is certain patterns or certain inflammation within the body. So like if they have an eye issue, if they have a shoulder or neck issue, if they have inflammation and lymphatic issues, I can already start to see the patterning. Now, I don't diagnose, but I do send the report to be interpreted to a board certified MD with the company. Then that report comes back to me, and then I share it with the patient and or the client, and we discuss it. And then from there, we're able to see, okay, what is our next step? What can I do to help guide you, refer you, dry brushing, lymphatic massaging, chiropractor treatments, or kinesiology.
Right.
I mean, there's so many
different
referrals
things
that you know will happen after we get the results.
Right.
But it's good. it's all great for the client.
Right.
Yes.
Will they
ma'am.
be able to take this and their doctor, the medical doctor, or naturopath or chiropractor, be able to see this and get some detail specific to their practice, maybe?
Yes, absolutely. Sometimes I've seen it where the posture is an issue, and you can actually see like one side is higher than the other because the posture is off. But sometimes too, if the bite is off, it can also throw off the posture.
Yes.
So if that professional is open to thermography, this is very valuable, beneficial for that professional and the client together, so we can work together.
What type of measurements, along with the thermography, when they're doing the readings, like with the shoulders off, is there a metric measurement system, or is there a posture angles that would be noticed on here?
If it's asymmetry,
yes.
If it means it's off balance and you can see it, and that's why it's so valuable to the chiropractor or the kinesiologist, because they can see, this, the left side is lower than the right, but so then
you need to
we need to figure out what's going on, because the body could be compensating on one side for inflammation, yes, that's why people have like their ankles hurt or their knees hurt or their hip hurts or their shoulder, because their body's compensating because they're not in balance. Okay. So yes, it's very helpful for other providers to have this thermography report.
How much time do you think it normally takes to get the report back?
It takes about 2.5 weeks, and then if there's holidays in between, then it might take just a couple of days more. But usually they're really good about returning the report within 2.5 weeks.
Really?
Yeah.
Okay.
Yes.
So what's been the most, having this new toy of yours, what's been the most exciting part or the profound part that you have learned using this camera as opposed to the other camera you was using? What is it that, jumps out at you, the difference in your testing? Like if something specific comes out that you would normally see.
That's a good question. I'm really crazy in love with this flare camera because it's so precise. I can actually see certain areas of the body that coincide with the burdens that are going on from the patient's symptoms or health issues. They coincide, and we can see it. Some people are very visual people, and so I can say, hey, come over here, come look at this. I want to share this with you because it's your body. And if they see it, they're like, oh, wow, because you can actually see the inflammation. You can see, something going on. You can, they not only feel it, but now you're right. You can see it.
With the visual part of it.
Exactly.
Yeah. What if there's something that has not been recognized by the client, and you see it on here, and you point it out, and a test result comes back that's actually what you saw? I mean, have you ever had that happen?
Oh yes, absolutely. Yeah. And with dental.
A whole lot with dental.
Again, it's the implants, it's the root canals, it's the mercury fillings, it's the metal crowns. When they come in and they're saying, okay, well, my eye and the right side hurts, my shoulder right side hurt, my knee and my hip hurt. I'm like, okay, do you happen to have any root canals or implants on your right side? Like, oh yeah, I have two root canals on the right side. I'm like, yes.
What about smaller things like moles or?
Yes, absolutely. This camera is so sophisticated. It does pick up the little moles, and sometimes I have to look at the camera and I have to, what is that? And I said, and if I look at their intake information and they didn't specify that there was any pain or anything in there, like, yes. And actually I have an image of that here. Mold right here. Of course, she is having pain and discomfort in this thoracic area, right? But then I kept seeing this little image, and I was like, "What is that?" I wasn't sure, and she didn't complain about it, or she didn't mention it in her form or anything. So I said, "Do you think I could take a look?" And I looked, sure enough, it's a little mole. It came up, and I was like, "Yeah, like that's amazing."
It is amazing.
That's how precise.
Wow.
And very sophisticated
And
this
you never
camera
would have
is.
seen it otherwise.
Yeah, the technology of this is amazing.
Wow.
You know, it's a wonderful thing that technology is evolving, but to be able to put it in place,
Right.
you know,
Right.
for the client and the
Right.
client to see it, and you can actually see the mole. That's amazing. It was
unbelievable.
Yeah.
And look at this. I don't know what that is.
So she was complaining about, or not complaining, but she was sharing with me about discomfort in the lower back area. And she said she's been, you know, seeing a chiropractor, but doesn't feel like the chiropractor treatments are helping at 100%.
Wow.
So she wants to, you know, find out a little bit more what's going on. And sure enough, this
That's
here.
significant.
Yeah.
That's very significant. I don't want to say anything about what that is until the doctor.
Right, we really don't know. We have to wait for the doctor.
Yes, to take a look at it.
But visually, you can
Yes,
see
we
that
can
there
see
is
this.
something going on.
It's hot.
What exactly? Right, exactly. I don't know, but again, it coincides with the symptoms that she shared with
So
me.
explain to me the color differences and what all of this means.
So the blue, the baby blue and the blue. Green is normal, but this is cold. The areas, there are certain areas of the body that are cold, and the green is normal. Now, anytime there is yellow and red, it means that there is something going on.
Right.
Could be degenerative tissue, could be inflammation, could be something going on within the organs. You know. Things like that. So those are the areas or the colors that we need to really pay attention.
Yeah.
Now, if it's white, that means that there is something that needs to be addressed. Absolutely.
Yeah.
You know, whether that support, like physical therapy, chiropractor. I mean, we won't know until the MD
takes a look at
it.
Yeah. But you as a thermographer know that that's something in your notes when you send your report over that this is what you noticed and you know what it
and
was.
I'll ask more questions too as we're doing some imaging. I'll ask like, what happened, or you know, I know you told me you have lower back pain, but tell me a little bit more. Like, I really want to dive into it, because the more information we gather and the better diagnosis it will be for the client through the MD.
Yeah, that makes good sense.
Yes.
Yeah. Well, this is amazing.
Yes.
I'm so excited about this. Is there any special workup they need before they do this, other than just to show up, or you know, like before and after drinking, eating, walking, exercising?
Yes.
Is there something that pros and do's and don'ts?
Yes, I have several do's and don'ts. Actually, before the client comes in, we have them fill out their paperwork ahead of time, and then there is a 24-hour sheet attached to it. Right. Like no massages, no any kind of energy work, any microcurrent work, no eating or drinking, no makeup, no showering, no deodorant. Yeah. They need to come in here natural. Yeah. Oh, natural. Like at birth. That's right. Because we don't want any of those, you know, makeups or fragrances or to interfere with the test or with the imaging, because it can interfere with the imaging. Okay. But there is, and it's very simple. Like, you know, no shaving, things. So simple. The protocol, the pre-care, and then afterwards, if there is something that I can help them already get started, as far as like dry brushing, lymphatic massages, let's get on it. Let's do it, you know, because again, it's to help them, to benefit them, so they can feel better. You know, that's our ultimate goal. So if you, someone who has had
like a thermography done like 3 or 4 years before, and something like this or any other significance present itself, how soon should they have another one done? Depending on the report, or you?
Yes, depending on the report. So when the interpretation comes back and the client and I go over the findings or the test or the imagings,
Right.
The doctor will say she needs to come, or he or she needs to return back in 3 months and 6 months. And if they do a whole body, they may not have to come back for the full body.
Right.
Maybe it's just the chest and the breast and the upper extremities,
Yes.
or just the abdomen.
Right.
It depends on what the results show. It depends on what the MD.
So it's not something I need to do like every 2 or 3 months, unless
it's needed. Yes.
Okay.
But for preventative reasons, I would say once a year.
Okay.
Just to make sure that we're watching, especially areas that maybe are not, like low level of inflammation or things like that. You know, we should continue watching those areas.
Okay.
Because that way we can help them in any way we can.
Yeah. That's great information. Yeah. Well, tell me about if you had special places or positioning. Is there a special in front of the camera?
Yes.
Like you just take it and shoot a person? No.
So
I mean, take a picture, not shoot.
the flare camera. It's amazing because it sits on the tripod and I can just move it, up and down, and I can just move it side to side.
Right.
The client does sit on a chair, on a stool, and every image is a little bit different.
Much like this one.
Yeah, just like that, yes. Okay. And then I have these little placemats. Some of the images are taken closer to the camera, and some images are taken all the way to the back of this, because I get the legs, we get the back, we get the whole body.
Right.
So yeah, there's different images required, close-ups or, images far away.
And things that you would use.
And then also we use a whiteboard, because sometimes when we do the feet, we want to make sure that we're covering the body. So the client will sit down and they'll use the board. They'll hold the board, because all I want is their legs or feet. Because we don't want these other images.
Exactly.
Yeah. But it's really easy. It's simple. All the images are... most of them I don't have to help, but there's some that I do have to come out and to help them.
Right.
But again, it's very private.
And easy.
Very easy. Very calm. Very peaceful. Yeah. Everybody's been so wonderful.
Yeah.
Yes.
Well, that's great. Well, it looks like you really do enjoy your work and what you're doing. I'm excited to have you, and I can't wait to have you back again. And maybe we can get together and do a little instructional about more about thermography, the benefits, the history, and all of that stuff.
Absolutely.
And in the meantime, I'll put it on Facebook so people can see exactly what it is that you do and how you aspire to help them and this practice to get people more informed about what the potential is and what's out there that can help them make intelligent decisions based on their health.
I do have to say, one of the most wonderful things about the thermography is no radiation. Zero radiation.
This is true.
That is the most. That was the seller for me.
Yeah.
Was the no radiation.
Right.
Because it's non-invasive. You can do this 15 times a year if you want, and you're not going to have an issue because it's zero radiation.
Wow.
This is just
a camera.
Just a camera.
Like a camera on the phone.
It's just like taking selfies, really. Yeah, pretty much. But
wow. But it gives you those results.
But it gives us wonderful information. Yes, absolutely.
That's amazing.
Here, there's another image too that I have here. Client had cataract surgery, but you can right here. You can see it. You can see the cataract surgery. You can see like the difference in her eyes.
Wow.
That's how you can tell that there's a cataract. Either they had
So
cataract
it's the light
surgery.
blue part?
I have the baby blue part.
Yeah.
That light part. Well, and again, and I know this because I've seen it in other clients and other imaging. And she shared with me that she did have cataract surgery there. But see how it looks a little bit different than her other eye.
Right.
So
different in what respect?
different, like the coloring. You know, because she hasn't had surgery in her left eye. It's only in her right eye. And so, again, that's how you can, like, oh, yeah. If she would have said to me, or she wouldn't have mentioned that she had cataract surgery, I would have asked. I'm like, hey, is something okay
Going
with your
on with your
eye?
eye.
You know, those are the things that we look at.
Yeah.
But because she did share with me.
It's a questionable place.
Yeah, absolutely.
Yeah.
But I'm glad that she shared that with me, and of course, again, coincides with what's going on with her eye.
Absolutely.
Yeah, really neat.
Well,
I really
that's amazing. I see down here. It looks like it's got tooth stuff going on.
Yeah, this is now in some of her other imaging. It did show up red and yellow, and again, I asked her, you know, did she have some metals in her mouth, and she said that she has some mercury fillings. And so, not surprising.
Yeah,
you know
that would be
that shows up. Yes, but again, that's something that
the doctor's going to the doctor's
absolutely
going to have to address.
Yeah, and then we can talk about you know options of a dental. You know, as far as like does she live close to a biological dentist? You know, a biological dentist is going to be the person to remove any kind of metals properly.
Right.
From the client. So again, depending on the report, then we'll refer out to the proper professionals.
Right. So tell us a little bit, and I promise this is going to be tell us a little bit about
we
your
can talk
history.
all day.
I know you have to get back to Conroe.
Yeah.
The weather is kind of questionable, but the last thing I want to ask you is, tell me a little bit about your background and your history and who you train with. Oh, look at that face.
It's been an amazing
5 minutes or less. 5 minutes or less.
Are you sure you're not? So background really quick. I was a traditional dental assistant. Traditional. I went to school in Austin, and Austin, Texas, and I went to school for a dental assisting, and there I was a dental assistant 14 years. Then I moved to Houston, and then I was placed in a temporary office, a biological office.
What?
And I didn't know anything about biological dentistry or anything like that, and it was Dr. William Glaros in Spring, Texas.
Are you serious? Dr. Glaros?
Dr. Glaros, yes.
I know of Dr. Glaros.
Yes. And when I started there, I didn't know anything about holistic, alternative, biological.
Right.
It was starting
all new. Yeah.
So I learned all the protocols, mercury surgery. I mean, everything that has to do with biological dentistry. And then in 2013, Dr. Glaros asked me if I was interested in learning how to do EAV testing, which is electrical acupuncture according to Vol for the teeth.
Yes.
And I did. Yes. And there was another Dr. Dawn Ewing. I trained with her.
I know
at the
Dr.
beginning.
Ewing.
Yeah.
She actually did mine.
Yeah. She's amazing.
Yes,
she's trained a lot of great doctors and a lot of great assistants.
Was the president of the association.
Yes, she was. Yes.
Yeah.
And then once I started learning EAV testing, I just because there's so much that is involved.
Yes.
I needed to learn more. So I have like medical Qigong certification, hair analysis, metal toxicity diploma, phlebotomy. I have ozone course. I mean,
let's not start with ozone.
Oh
That's
God, yeah.
Okay.
I'm a fan of ozone.
Yeah. So am I.
I am a strong believer in ozone therapy. It's amazing.
Especially in biological dentistry.
Yes, it's amazing what it does.
Yes,
amazing. Then I decided to go even more. And so now I'm a herbalist. I recently graduated and received my associate's degree. Thank you. associate degree in herbalism, so now I'm an herbalist. But there's so many diplomas and certifications that I've been able to do, and I've been able to just kind of dive in the different modalities.
Right.
And all those modalities, I just bring it all together.
Exactly.
Yeah.
That's very, very important to be able to interlink or to interlink or make them integrate into.
I like absolutely interconnect them together because I feel
it does have merit.
It does. It really helps. Not just me, but also the client and the professional.
Exactly. And it leads to other things that, at least an idea of what could be out there that could be causing other root causes of the problem.
Yeah. So I think it's very important.
I'm so excited for you.
Thank you. Thank you. Yeah, we're just going to keep on going, keep on learning. We're excited to see what else we can incorporate in the practice, next year too. But we're going to keep on going.
Well, I'm so happy that you decided to agree to come and share with us your expertise and your knowledge. And I hope that you'll come back again.
I'm so grateful for you and all the wonderful work. Everybody raves about you. They love you.
Oh my goodness.
You do wonderful work.
Well, I appreciate that. Thank you so much for sharing that with me. I really appreciate it. We all work for the same reason, right? To make God's people healthier and happier and safe so they can go out and spread it again to others, right?
Yes, that's right. So, you're here to serve.
Well, I'm so happy that you came today.
Thank you for having me.
And you have a safe trip home.
Thank you.
Okay?
Yes, ma'am.
I look forward to seeing you again.
See you next time.
Okay.